Welcome, everybody. It's Dr. David here from El Paso Manual Physical Therapy to tell you you can avoid a knee replacement if you don't do these exercises that I'm going to cover with you today. Thank you guys so much for joining us here live. I am live right now. Like, you can comment, and I'm going to probably read your comment. We're going to have a helpline soon here as well. We'll flash the number when we're ready to start taking calls, and you guys are going to be able to ask me any question you want. Hopefully I can get you unstuck and moving forward and making progress in solving your knee arthritis problem. So before we go into the lesson today and answering comments and questions, type a comment, please, and just let me know that where you're from and say hello. I'd love to see that here. I can see comments here. Looks like we have 80-something people here. Julie Parker's here from Sydney, Australia. Hey, Julie. Thanks for joining us again. Julie's always here. Kimberly's always here too. Hey, Kimberly. She says, hello, Dr. David, EPMPT, and all the viewers. She says hello to everybody. How nice of her. Shay says, hello from San Antonio, Texas, a fellow Texan in the house. Fantastic. So we have people from all over the world already. The U.S. as well. Virginia's here. Nelson's. Jay Stone is in Florida. Thanks for letting us know. Shelly's in Chicago. So cool. We have Cindy from Odessa, Texas. She says, good afternoon. Hey, Cindy. Welcome back. Another Texan. Another Texan, Grand Prairie, Texas. Steve Drake says, where nothing ever happens. Oh, I'm sure there's always something going on. We have Kim in Toronto. Fantastic. And then good afternoon from California. Great. Asasa. And then we have, Dr. Lyons is here. She's a regular now, too. From Los Angeles. Fantastic. So we have the East Coast and West Coast covered. Oh, we got a question from Cindy. Cindy says, how important are supplements? I know you've talked about them before. I take them, but then sometimes I stop. I don't think I can really tell any difference. Great question. And Cindy, you're probably saying what a lot of people are thinking, because that's what happens often. I can't give you like a percentage or a hard answer, an objective answer on how important supplements are. Really, it's an answer that you have to find out on your own. And when you arrive to the answer that you've arrived to where you can't tell a difference, then you've probably been able to figure out that they're not that important for you. However, there are people out there that will take certain supplements and they'll say, wow, they really make a big difference. So then it's probably more important for that person at that time, because I really do think that depending on where you are in your stages of healing, along with your current diet, your nutrition, what you're eating, all of that can help influence the decision on what supplements you need to be taking or not. So if you figured out that it's not really helping you out right now, then you could probably stop. But you do need to find something that is working for you, because if you have knee arthritis, there's probably something that you should be doing right now that will make it improve without surgery. It's a good question, Cindy. Hello, Dr. David, watching from North Texas. Lots of Texans here. Fantastic. Nobody from El Paso, though. Just us, I guess. Becky Major says, she's in Grants Pass, Oregon. Great. We got all four corners covered. Beth Rose says, some of you truly need to go see ortho instead of relying on someone online. Some cases are too severe, and some exercises recommended can hurt you worse. If you know, you know. Beth, people are trying our stuff and getting better. It's not like all doctors online don't know what they're talking about. And I strongly agree that there are some people that do need to go see a doctor in person. And I talk about that all the time. If things that you're trying that we recommend that are very easy and light to do are not working for you, you absolutely should go talk to the doctor, because getting some in-person advice is helpful. However, there are a lot of people that do try some very basic stuff that we suggest and get better. In those cases, I think you might try some of our next level stuff or advanced stuff, maybe even sign up for one of our programs if it's right for you. Because the truth of the matter is, if you go the doctor route, very often you get told to take medications, which don't fix the root problem, then get an injection, which doesn't fix the root problem. It just masks the symptoms a little bit better than the pain medications that you take by mouth. And then maybe try physical therapy, which I'm going to talk about some exercises that physical therapists recommend today, and they often make you worse. And then if that doesn't work, the PT says, I'm throwing my hands up, I quit, go ahead and talk to the surgeon. Then you're signing up for surgery, and the root problem was never addressed. And my heart goes out to some of you guys that have had a surgery, or you're very, very much on the path to having a knee replacement surgery, and you don't need to. You could have avoided it if you had you known to fix a root problem, but this stuff is not taught in medical schools and physical therapy schools. And so sometimes it is worth to do some digging and find an expert that works for you. So Beth Rose, I wish you the very best in whichever direction you take, but don't knock it until you've tried it. Who else is here? Ruth says, hello from the Isle of Man, Great Britain, United Kingdom. Hey, Ruth. Thanks for joining us. Great Britain's checking in. That's great. Becky Major says, we can listen online and still go see an ortho. Exactly. Yeah, you can do both. And I like that a lot because you can compare. And, I paint the picture for some of you guys sometimes, and you guys are like, yeah, that happened to me. I ended up going to the PT and I got worse. And I'm going to list for you 10 exercises today that PTs commonly do and just mess things up, and unintentionally. I don't really think that they're trying to intentionally hurt you. They're just not experts in helping people avoid surgery. PTs are experts in helping people rehabilitate after having a surgery, and orthopedic surgeons are experts in performing surgery. And before they perform surgery, they're really good at identifying somebody who might need surgery, but they kind of suck at identifying somebody who can avoid a surgery successfully, and then guiding them through the pathway on what to do to avoid the surgery. That's what I specialize in. I can tell you there's a big difference in the way that we do treatment. Deborah, let's see, Deborah. Deborah is in Amherst, New Hampshire. Good. Fantastic. You guys are getting me riled up, and we're just barely going through the names here, through where everybody's from. Hi from Denmark. That's Lisa Lind. And then we have Kit Kat, says hello from the UK. All our Brits are checking in, all our Europeans. Lori says hello from Michigan. So cool. Alaska's here. We haven't seen Alaska in a while. Anna Maria, thanks for joining us from Alaska. Great. We have Tessie from San Francisco, Pacifica. Very cool. Lisa Johnson, hail from Shenandoah Valley, Virginia. Awesome. Marianne Harris says hello from Vancouver Island, Canada. Great. Thanks for joining us, Marianne. Chuck is in Pittsburgh. Pittsburgh in the house. 2 years, two-year torn meniscus trying to heal. Great. That's super healable. So many surgery, more and more stories are coming out of people that have had a meniscectomy, where they have a chunk of the meniscus cut out, and it leads to faster arthritis because it makes sense. It's a chunk of cartilage that your knee probably needs in order to prevent arthritis, because arthritis is when the cartilage gets squashed and it just progresses things. So I think you're in good shape trying to protect it so that you don't get arthritis. Deb King says hello from Ohio. This time we're going to take good notes, so I do all your exercises. Great, Deb King. Get your notepad out. Get your pen. Caroline Shipsy. Hey, Caroline from the UK. She says, hello, Dr. David. I'm having a problem the past few days with both knees. It feels like both patella are slipping and catching. The pain is really sharp and sudden. What is happening? Oof. Oh, it's hard to tell with just that information. I want to know more. Like, is it constant? Does it happen with certain activities, or just at certain times of the day? Like when you're more tired, usually is when it might happen, or does it happen first thing in the morning when you're fresh? I'd want to know that. The possibilities on this are, it could be that you have flared things up and they're just more sensitive to your everyday activities. And so you might have had some like increase in activity, like you were on your feet more, you did some chores, you moved, you went through some higher level of activity in your life, and that aggravated the joint. And now it's hurting with just normal things that didn't hurt before. That's what usually happens in this case. But drop some more comments on that, Caroline. Maybe I can help you out more. Or call us if you can. That'd be great whenever we are ready with the helpline. Pizak says, can I still apply all of your wisdom to my knee problem with a Baker's cyst? Oh, yes. A Baker's cyst, Pizak, is the beginnings of arthritis. It's fluid that's building on the back of the knee joint because the middle part of the joint is irritated. And so the fluid builds up in an effort to protect the joint and try to heal the cartilage. But when the fluid just keeps building, I think some of us are just predisposed genetically to doing that. and some aren't. Some people never get a Baker's cyst, but they get arthritis. Well, the fluid has to go somewhere, and the back of the knee joint is the most vulnerable part of the joint, and so that's why it goes back, and you get that Baker's cyst. The idea of a cyst, though, it's misleading. I think it's not named appropriately because it doesn't connect it to knee arthritis. But I think we should all think of a Baker's cyst as a symptom of knee arthritis. So by doing knee arthritis treatments, like things that I recommend, it should theoretically help the Baker's cyst. However, the problem that I see a lot is the Baker's cyst doesn't go away as far as the appearance of it, but the symptoms can improve. The pain can improve, the stiffness can improve, and making it worse, you can keep it from getting worse. So I think, yeah, you should still apply all this stuff to your Baker's cyst. And the doctors don't see it that way, by the way. Most orthopedic surgeons out there and PTs, they see the Baker's cyst and they're like, oh, you have arthritis and a Baker's cyst. And they're thinking of them as separate problems. And in their head, they're literally like, well, what treatment should we do for this? And what treatment should we do for that? They're separate things. That's how they treat a lot of things, like a meniscus tear and arthritis, or a hip arthritis and knee arthritis. They'll see them as separate problems, but it's the same root problem that affects all of those things that I mentioned. And if you fix that root problem, you're going to affect the hip and the knee pain for the better all at the same time. We got another part to this question. Caroline Shipsy's back. She says, no swelling at the moment. Fantastic. Happens when walking at any time. Okay. So then, yeah, it's probably that you flared it up, Caroline. If you weren't hurting before when walking, and then it started to hurt, something changed. And if you didn't have an increase in activity, like you were starting to exercise more, or you just had a busy day or busy weekend or something, then what I begin to think is that it's probably that you hit a threshold of aggravation that now it's just constantly aggravated. So you got to go back and fix the imbalance. You got to think to calm the knee down. You have to maybe do some massaging on the thighs, on the thigh muscles, the quads. Do some tailgate swinging. You have to do phase 1 activities. I say phase 1 in open air quotes because I talk about our phases of the knee arthritis program often. Offloading is going to be a big one, which I'll talk about in a moment. You have to do things to calm it down, and then you'll probably be able to get back to the normal things that you do without as much discomfort. But it sounds like you're in that sensitive zone, and you just overdid it somehow, some way. Maybe not sharply, but maybe gradually overdid it. Wish I could see you in person, Caroline. I'd get a lot more help here. The empathetic coach. Hey, Dr. David, I have really great news. Oh, cool. I've done your exercises, and I have almost full mobility in my shoulder. Awesome. Liz from Long Island, New York. Remember me from your last live? I do remember you from the last live. Yes. Thanks for updating me, Liz. That's super cool. Glad that your shoulder's feeling better. It makes a big difference fixing the root muscle imbalances. Robert is here, not joining today. Just wanted to say hello from Austria again. Last week it was quite interesting, though my main problem is the back. I find your thoughts and recommendations quite helpful. Well, thanks for chiming in, Robert. Thanks for those nice words. I appreciate it. What exercises should we avoid? Oh, we're going to get all into it. We get into it now? Fantastic. So on that comment, let's get started here. So before I do the exercises, I do need to give you guys some big principles to understanding why you shouldn't do these exercises, because I don't want to just spit out like, I don't like this exercise or that exercise or this exercise without giving you some reason why. You need to understand why I don't like the exercise, because then you can begin to apply the ideas to other exercises that you might see out there to determine if they're right for you or not. So principle number 1 is, if you're in pain, if you stand up and you're walking like Caroline's doing right now, or if you do some activity, like you get up out of a chair, or you go sit down on the toilet, or you do some laundry around the house, some chores around the house, you're at work, if you work, you're playing with the grandkids, whatever it is that you do, if you feel your knee hurt in the moment, and it is consistently hurting you when you do those activities, then what likely is going on is your tissues, your cartilage inside your knee joint, maybe your meniscus, the bone, the cartilage behind the kneecap. Let me just show you here so that you don't have to worry about the imagination. Cartilage here. So there's the kneecap, and it touches the thigh bone right there. So right there where it rubs if your cartilage is irritated, and then between the thigh bone and the shin bone down here on the where the cartilage from the thigh bone touches the meniscus and the meniscus itself, all of that can get affected with arthritis. If it's too irritated, it cannot take too much pressure. When you go stand on it, you're putting pressure on it. It's supposed to be able to take a lot of pressure, because if you were healthy, you could walk and stand and do everything. So if it can't take pressure right now, then we need to figure out ways to take off pressure. And the number one way that I recommend taking off pressure is by offloading. And what I mean by offloading, I'm just going to draw that in a box because this is principle number one, is you need to take weight off your step every time you take a step. And it's not always practical to do it in every activity, but if you can begin to do it in 25% of your activities, 50 or more, if you can get a device like this, a walker, or I don't have a cane handy, but a cane or a crutch, anything that you can bear weight on, I'll show you on the side camera here, so that when you walk, say it's my right knee here, this one that I'm moving around, so that this one hurts. So when you walk, you don't put the full pressure through it, because then that puts that pressure through the cartilage on the kneecap, on the thigh bone. If you can get a crutch under you, so you would put it opposite of the side that hurts typically, and walk like so that you don't put full pressure. The more steps you can take like that, the more percentage of the day that you can spend offloading your poor knee that is hurting you every time it takes a step. It's screaming at you saying, ow, I hurt. I can't take this pressure right now. But you're making your body do it anyway. That's what further irritates the knee joint and gets, eventually you might get swelling. It becomes more painful with more activities. That's what usually gets a lot of people to the threshold where they're saying, I'm desperate. Pain medication doesn't help anymore. The injection didn't help. The physical therapy exercise didn't help, because they're not offloading ever. They're not getting their cartilage to become unirritated. And so they can't strengthen muscles because it further irritates things. So the number one principle is we have to offload somehow, some way, because your knee is a weight-bearing joint. All right, so keep that in mind as we go through exercises, but I have two more principles for you. Next principle is glutes. Glute activation is absolutely needed. And here's why. I'm going to come over to the skeleton so you can see this. This is critical. Right now, this right here is the explanation that I wish I could give every orthopedic doctor in school, every physical therapist in school, and it would immediately increase their knowledge in why somebody gets arthritis in their knee joint. So here's the knee joint down here, kneecap, thigh bone, shin bone. There's too much pressure going through the joint, and it's consistent over time because of a muscle imbalance. And the main muscle that feeds into this imbalance is the quads, the thigh muscles, these ones that are on the front of the thigh. All these muscles converge and they attach to your kneecap, and then you have a tendon that runs from the end of the kneecap down here onto the shin bone. Let me show you on that model that I have. Here's the right knee. So this is the quad tendon. So you have to visualize all the big quad muscles right here. They come together onto the kneecap, and then you have a tendon that continues down and attaches to the top of the shin bone right here on this bump right here. It's called the tibial tubercle. Can't get my words out today. Anyways, when that muscle's too big and strong, it pulls the kneecap harder against the thigh bone, and then it pulls the shin bone up into the thigh bone and holds a lot of extra pressure through the knee joint. And this is what perpetuates osteoarthritis, what makes arthritis worse, because there's too much pressure in the joint. And the way to take pressure off the joint is to not make these quads work so hard. So here's the trick. If we can get the glutes, the muscles on the back of the hip, to work better, to work appropriately, to work at the right times, because the glutes attach from the rim of this bone here, and then they come down and attach to the outside of the thigh bone. This is the top of the thigh bone, the same bone that goes down to make the top half of the knee joint. And when the glutes work appropriately, then you have more stability through the thigh bone, which means you don't have to call on those quads, the thigh muscles on the front of the thigh muscles to work so hard, because that's what happens is if the glutes aren't strong enough, they're not performing the way they're supposed to when they're supposed to, then the quads in the front compensate. They take up the slack. They pick up the slack. They take over for the stability and movement that the glutes aren't doing. And so when they take over, they're doing that all the time. That means that they're getting more reps, more activity, more exercise. So they get stronger and dominant over time, which then compresses your poor knee joint over time. That is the cause of osteoarthritis in the knee. So therefore, if we understand that, then it is reasonable to assume that glutes are absolutely a key muscle to focus on and strengthen. And for many of you guys with knee osteoarthritis, you don't even have control over your glutes, but you can control your quads. If you think to tighten your quads, your thigh muscles, they work right away most of the time. But when you think to tighten your glutes, you can't do it. In fact, often your quads on your thighs will activate when you try to get your glutes to activate, which is a clear sign that you have this muscle imbalance, because every time you go to do an activity where you're supposed to use your glutes, your quads are working and your knee joint is being smashed and you're making your arthritis worse. This is what is not taught in the medical field. Beth, who commented earlier, you should go see a doctor. You're not going to get this at the doctor's office. They're going to just say, do quad exercises, which I'm going to list a bunch of today, and hope that they hope that it makes things better, but it actually makes you worse, which is why the PT is going to say, oh, well, we tried PT, didn't work. Let's send you back to the surgeon and see what they have to say. And the surgeon is going to say, well, we tried injections, medications, and PT. Time for surgery. Unnecessarily. We never figured out glutes. So that's a key principle here that I'm operating off of is first offload your poor knee joint because it's just screaming at you and you're just chugging along through it. You're just walking through pain and you haven't taken out a crutch or a cane or a walker. Then second is you need to figure out what's going on with your glutes and get them to be active. You need to become aware of your glutes and conscious of activating them and then deliberate about using them. Number 3. The obvious next one is avoid quad strengthening. I'm going to write STR for strengthening. You have to avoid quad strengthening at all costs right now. And a lot of people get worked up about this because then they say, well, then my quads are going to get weaker and my knee arthritis is going to get worse. But that's not the case. I mean, avoid quad strengthening while you're getting your glutes stronger. Because if you pursue quad strengthening with already dominant quads, then your level of quad strength is up here while your level of glute strength is down here. And if you work on quads, you're just going to get them stronger and there's going to be a bigger discrepancy, which means more pressure through your knee joint and worse arthritis. And then we have people out there that will argue with me and they'll say, well, why don't we just strengthen everything? Glutes, yeah, you're saying glutes are important. Let's strengthen those, but also strengthen quads. But you're already imbalanced. You're just going to keep the imbalance as you get stronger. The pressure remains. But if instead you get the glutes stronger and you're not losing strength in the quads, you're just keeping it there. But if you get those glutes stronger, you get to the right balance, now you can strengthen everything appropriately, because later, when you're feeling better, when the pain isn't there, when you can walk for as long as you want, when you can return to all the activities that you like without knee pain, then you will by default be working out your quads, because all your muscles work when you go walk, when you go hike, when you do the laundry, when you do chores. All I ask is that you first take some time to figure out how to get your glutes involved and keep them involved throughout the rest of your life so that the pressures are normalized in your knee joints. All right, so those are the 3 principles. Very important. I'm going to keep referring back to them. Now, let's get started with the exercises that you should not do, that you don't want to do them if you want to avoid having a knee replacement because you have knee arthritis. Number 1, one of the most common one here, going to be quad sets. And let me tell you some history behind quad sets. Let me show you what it is first, so we all are on the same page. I'm going to come over here to the table. You guys, if you've been through physical therapy, if you've ever searched exercises to do for knee arthritis or to avoid a knee replacement surgery, you're going to see this exercise. And what they'll have you do is just put your leg out on a table somewhere, basically have your leg supported, look at your leg, and then these muscles right here, your quads, they want you to just tighten them up and make them get a little tired. Straighten out your knee, hold it for 5-10 seconds, or maybe just do reps where you just hold it tight, relax, hold it tight, relax. Sometimes they'll have you put a rolled up towel or a pillow like this under your knee, and they'll tell you just to give you a cue, flatten the pillow or flatten the towel so that you can get your quads to activate. It's all the same thing. The idea is to strengthen the quads, and the history that I want to tell you behind it is this is a great exercise if you have just had a knee surgery. Think about it. If you just had a joint replacement, an ACL reconstruction, a meniscus repair, what often happens after the surgeon does a good job going in to do their surgery is they have to make incisions and cut and get into the knee joint. Well, the muscles above and below don't work very good. In fact, they probably put something called a nerve block in your muscles up here so that these muscles aren't spontaneously activating while you're in surgery. They kind of numb everything and shut it all down so that the surgeon can do their work. So after you're recovering from the surgery, the surgeon naturally wants you to regain your activity in this muscle because you need it to walk and do other things. So that they've instructed physical therapists to tell the patients who are rehabilitating from a surgery to go do quad sets, to wake it up again. And that's a good thing. But once it works, once you can tighten the muscle, once you have conscious control, we're done here. And you don't need to continue to activate the quad more, because then we're violating the principle of avoid quad strengthening. And we're not focusing on glutes, and we're maintaining that discrepancy of high quad strength and low glute strength. We have an imbalance. So don't do quad sets if you have knee arthritis, especially if it hurts. You should be offloading. When you do a quad set, it actually compresses the joint and it could set off more pain. So we shouldn't be exercising the quads. Another version of this will be knee extensions. And let me just show you what that looks like here. Is you might be sitting on the edge of a table like this with your legs dangling down, and they might tell you to straighten out your knee because that makes your quads work here. Straighten out this one. Doesn't matter. Straighten them both out. The idea is when you do this, it tightens up these muscles. In fact, they might even put something like this, a band around your leg, and usually they'll tie it to like the foot of the table. Let me just do the setup here. I should probably do it on my other leg because it's closer to the leg of the table. They'll put a band around your ankle basically, and then they'll tie it up. I'm just going to hold it. They'll tie it up against the table, and then they'll have you extend against some resistance here so that you're working your quad. Sometimes they'll have a machine that has a stack of plates, and you put the pin, and it's got a big pad that goes over the front of your lower legs, your shins, and then you straighten out both legs or just one leg at a time against resistance from the machine, and it's working out your quads here. All of that is, I think, extremely detrimental to knee arthritis. It's increasing the pressures inside the knee joint by strengthening the quads excessively. They're already dominant. They're already compensating. They're taking over because the glutes aren't doing their job. If you don't have good glute activation when you consciously try to make it happen, then you should not be working your quads. So these quad sets and knee extensions are unnecessary for you at this time. All right, let's go to number 2. We have hamstring curls. We talked about the front of the thigh. Let's talk about the back of the thigh, where the hamstrings live. So let me show you what that looks like here. So if you're looking at the side of my leg here, there's the kneecap, right? Quads are on the front, and these muscles that are on the back of the thigh are your hamstring muscles. And these muscles, they come in and they connect to the top of your shin bone here. Let me show you in the skeleton. The hamstrings start right here. They attach to this part of the bone, your butt bone where you sit down, and then they run down and they kind of split. There's different muscles, and they attach to this part of the shin bone down here, the top part of the shin bone. And when they contract, they can do two things. The thing that everybody thinks about, though, is bending your knee. That's number one thing that everybody thinks about. That's a hamstring curl motion. But the other thing that it does is, because it crosses your hip joint, is it can extend your hip. So it can help the glutes. But if the glutes aren't ready to work for you, guess what? Your hamstrings can also compensate in place of weak glutes. So if you go do hamstring curls for exercise and your hamstrings are getting stronger, they're probably already strong because they're compensating, your glutes can't even activate, you're just going to make your hamstrings even stronger, your glutes just stay behind, and you're making that muscle imbalance worse. So the way that the exercise looks, there's different versions, but you're usually lying down, face down to start, and they'll have you bend your knee like this. And when you do that, you're activating your hamstring muscle. They might put an ankle weight on you so that you have a little bit of resistance. Or there's machines as well where you'll lie down, face down like this, and there'll be a pad that goes over your ankles back here, and then you bend your knees against the resistance. And then you can also set up a rubber band in different ways. The idea, though, is that you tire out the back of these thigh muscles, the hamstring muscles. I think it's not a good idea. The other factor that I didn't even mention on the skeleton is when you have stronger hamstrings, just keep in mind of the mechanics here. All this is mechanics based. This is why it's so important, because osteoarthritis is a very mechanical condition. When the hamstrings because the hamstrings attach to this right here, this part of the shin bone, if the hamstrings get very strong, they can increase the resting tension that they have, meaning at rest, they're just tighter. Just like if you go work out your arms, your biceps, they get firmer. That's increased resting tension. Same thing with your leg muscles. So that means that at rest, when you're just sitting around, they're adding compression to your knee joint, which worsens arthritis. So we need to get, my leg fell off. We need to get stronger glutes, because the stronger you get your glutes, the more you're going to calm down the use of your hamstrings and make it a normal, just typical use of your hamstrings, not a compensated use of your hamstrings. I think I lost the screw that holds that on. I'll just leave it there for now. We'll still make use of it. Oh, there it is. There we go. All right, so that's hamstring curls. Guys, I want to let you know that the helpline is open right now. So the number's running on the ticker on the bottom of the screen there. The number is 915-200, there it is, 4159. 915-200-4159. Give us a call. Somebody's ready to answer the line, and then if it's right for me to help you out, we'll bring you on, and I'll be able to talk to you live and answer any questions you have regarding your knee arthritis, hip arthritis, or whatever other conditions you might have. Great. We're going to comments here next. All right. So those are the principles. We talked about quad sets and hamstring curls as exercises that you should probably be avoiding if you have knee arthritis. What questions have you guys put into the comments here? Let's see what you guys got. Julie Parker says, so that part behind my knee that feels tight and won't let me bend the knee all the way or straighten properly is the hamstring. Also, the outside of my knee pains when I try and bend the knee. It could be your hamstring, very likely. So okay, that's the same comment. It could be that there's a Baker's cyst going on there too, that the fluid's built up on the back of your knee. That could prevent you from bending properly and could definitely cause pain. But it could be the hamstring too. And what you have to realize too, I'm saying that these muscles are over dominant, strong, and compensating. But there comes a point. I mean, think about it. If I gave you a weight, if I put I don't have a big weight here, but it's okay. We'll use this. So this is a full 40 ounces of water right here. So it's not light, and it's metal too. If I were to just do curls, like I could do, probably 100 or 200 curls with this weight, no problem. But after that, somewhere, we're around 150, I'd start saying, I feel it. Think about how many steps you take. People take thousands of steps. Imagine doing thousands of curls. Your arm would eventually scream and yell at you. It would hurt. It would tighten up. And if you force yourself to continue walking, to continue doing your daily activities, your chores, all the things, your muscle would then, it would get worked out, but it would eventually get fatigued and possibly even sprained. You would have a muscle strain. That's the right word. And so you could strain your hamstring, you could strain your quad, and it can appear weaker when it's strained because it's injured from an overdominance, because you've been using it too much, because you didn't get help from your glutes. So it's very possible that that's why you feel tight, and that's why you don't have the full range of motion. Could be other things too. You might have a meniscus issue. There's a lot of things, Julie. But I hope that explanation helps, because some people get confused. They're like, wait, you're saying the muscles are too strong, but mine feel weak. Mine feel even kind of injured. How does that work? It's because it's overworked and it becomes injured after a while. Dr. Lyons says, if there is occasional pain shooting down to the ankles, can strengthening the glutes help with this if it is arthritis plus a pinched nerve, for example? Yes. Yeah, you can get like a sciatica type pinched nerve or a pinched nerve from your lower back. And those nerves do run all the way down. Some of them run all the way down to the heels of the feet, and into the arches of the feet and into the toes of the feet. So it's very possible for you to get a pinched nerve from your back or your hip, and that the hamstrings in the back of the thigh, they are right over the sciatic nerve, so people can get tightness sensations there. And strengthening the glutes often helps, because if your hamstrings are tight in the area, you can usually relax the hamstrings by getting the glutes stronger. Plus, getting the glutes stronger very often takes pressure off your back and the SI joint. The SI joint is what can get affected or shifted, stuck, and can set up a sciatic nerve problem, which can present in the foot. Very frequently, people with sciatic nerve problems or nerve radiation that goes down into the lower leg and foot, I am working on glute strengthening with them, Dr. Lyons. Absolutely. Yep, it is critical. We don't strengthen our glutes enough. It's a good word. It's the sugar of, you know how sugar's evil in nutrition. I mean, we all need some sugar, but too much sugar's a bad thing. Like, we don't get enough glute strengthening, and we think we do, but we don't get enough. It's like fiber is probably the one that these days that people don't get enough of. Bad analogy. I'll think of something better. Diamond says, I've even had RFA knee ablation, and it hurts more now than it did before. It may be a torn meniscus, but my doc just believes it's time to replace. Shake my head. Yep. The RFA, the ablation, they're burning the nerve that goes right in front of the knee, right in the knee area, in hopes that they'll just shut off the pain. But the muscle imbalance is what's often irritating the nerve that's causing the pain, plus the meniscus. It's just irritating everything in the area. Because I love this one. Let me show you on the skeleton how this looks, because the nerve pathway, so the sciatic nerve pops out right here, goes down the back of the leg, and then you have a nerve on the front side of the body that branches from these nerves up here, and it goes down the front of your thigh and into the inner knee. Let me draw it to myself. That'll be even better. What color should I use, guys? Probably black. Yeah, black. Will that show best? Okay. So you have a femoral nerve, which runs from about right here, and then it goes down on the inside of your leg, and it becomes a saphenous nerve. The femoral nerve itself, it's innervating your quad muscles. So I'm just going to see if it shows up here. That's a Q for quads, and you have branches off that femoral nerve that feed your quad muscles, and then right around here it turns into what's called the saphenous nerve. And that saphenous nerve goes all the way down your inner leg into the arch of your foot, right there. Okay, so this is important for you to understand. It goes on the inside of your leg. And then where you get the radiofrequency nerve ablation, or sometimes they do a nerve block to test it, there's a branch from about right here that wraps around the front. It's a branch off that saphenous nerve, and that's where people often have knee pain. It's right on top of the meniscus. You can Google this and look this up. It's the saphenous recurring nerve, or the genicular recurring nerve. It's got different names. If you look up nerves in the knee, you'll find this. And the meniscus is right under that line that I drew where the nerve is. So the doctor will go in and burn the nerve right here so that you don't get pain in the front, But now think about this. If your glutes are weak, you might need to get a whole leg view here. Let me move over. If your glutes are weak and your quads are over dominating things, then what tends to happen is the leg kind of falls in. And if you have a weak arch down in your foot, it collapses down. And when you fall over this way, you can see the nerve that I drew, it tensions it because it pulls on everything. It's just pulling on everything all the time. And if you stand with your knee locked, it tends to use your quads. And very often, if you stand with your knee locked, your quads are locked and glutes aren't doing much back here. So you need to think about fixing the imbalance in order to take tension off the nerve so that your leg can rotate out a bit by getting your glutes stronger. Because going back to the skeleton here, the glutes attach from here to here. From the rim of this bone, there's the SI joint. That's why SI joint's important, to the outside of the thigh bone. And if you have good, this is tight. There we go. It's coming loose. You fixed it for sure. Can't move the hip now. There we go. All right. So glutes attach out here. When the glutes are more active and they have an increased resting tension, which is good, we want that, it pulls the thigh bone outwards, which brings my leg out, and it takes tension off the nerves, which often solves chronic knee pain because we're normalizing pressures and everything going through the knee, the nerves, the meniscus, the kneecap, the patella. It's aligning the patella on the thigh bone properly because that gets misaligned all the time. Let me show you one more time here. This is so good for the explanation here. If my leg falls inward like this, there's my right knee bone. The thigh bone rotates in, and because my quads are active, it pulls the patella off the track on the thigh bone right here. So that's where people get a lot of bad pressures going through the kneecap, or sometimes they say their kneecap shifts out of place. And they get tendinitis in the area, bursitis in the area. Of course, osteoarthritis develops over time. But if we can get the glutes to be active back here in the hip, then we can shove the thigh bone into the proper place and restore the right tensions, the right pressures of the kneecap onto the thigh bone. The nerves can get affected too. So I hope you can see how this muscle imbalance, let's come back over here, affects so many things in the knee. It's not just the cartilage, it's the nerves too. So that, let me get all my stuff out of the way here, sorry. Making a mess. I don't know where my sock went. We'll just go without a sock. What's over there? All right, so I hope that answers the question. Sorry, it was a big tangent, but I think it was a good one because I explain this to patients in the clinic all the time, and it makes sense to them when they're talking about nerve-related symptoms or like a nerve block, and so many people don't understand how this works. Even the doctors don't. They just go inject it or burn it, and it's a solvable problem. You have to put in some work. You have to get the muscles to work right, but you can fix it most of the time. Who else has a question? How can you tell if you have a good glute and quad balance? Great. Well, number one, your knee isn't hurting and you don't have any pain anywhere else. And so that's the one. But another sign is you can consciously activate your glutes, and you can activate your glutes independently of each other. Let me show you this chart that we have that we use for our programs. This is for the knee arthritis recovery program. Hope you can see that. Yeah. And so on these are our phases of the program. So in phase one, if this is the first time you're seeing this, this is when the symptoms are really bad. You have swelling, pain at night. You don't have to have all of them. You just have to have one, and it qualifies you for the lowest stage that you're in. And on the bottom of every phase, I have a word about the glutes. And if you're in phase one, it says cannot flex or tighten glute muscles. Other muscles flex instead. If that happens to you, then you are in phase one, and you should be doing phase one activities. In phase two, you can flex your glutes, but not left and right individually. It's important because in phase two, we cover walking. In order to walk properly, you have to be able to flex one glute at a time and have good control over it, because you won't be able to effectively walk without being able to flex your glutes independently. Then after that, your glutes could flex independently, but they get tired too fast with more activities. That's when we know you're in phase three. And then by phase four, your glutes are are working for you all the time, and they can hang with all the activities that you put them through, no problem. So that's the best way to tell. There isn't like a measurement that, like an objective number. There's not some like scale I can put you on. If I were to assess you in person, I can generally tell because that's just my expertise. But I can't say that I can tell you to go to a doctor or a physical therapist and they'll be able to tell you with accuracy that you're in the right imbalance. But by the way, a lot of healthcare professionals out there will say imbalances. They'll use the term, but they don't really have it defined the way that I've defined it. The way that I told you about glutes versus quads. They'll just say you probably have some muscle imbalance, and they leave it vague. It's undefined, and they'll just say that that's going on, but not really do anything about it. And that, in my opinion, is the missing link to fixing knee arthritis without surgery. All right, we're going to take a call. We have Beatrice from Miami Beach who has an ACL tear. All right, let's talk to Beatrice. Get my sock on so I don't feel weird. Just one sock on. All right. Beatrice.
Hello.
Hey, Beatrice. It's Dr. David. How are you?
Hi, Dr. David. Wow, such a pleasure to talk to you. That's wonderful. Wow, thank you. Thank you for the opportunity.
Absolutely. I'm glad you're able to join us. Well, how can I help you?
Yeah, thank you so much. Well, okay, so I was telling the person who I talked to right now.
Yeah.
But basically, I had an accident. I fell and I fractured the tibia plateau. It was a closed fracture.
Okay.
And also I had an ACL. The ACL was torn, not completely, but it was done. The doctor said I didn't need surgery.
Oh, good.
So I have been going back and forth to different doctors, to different physical therapy. They have been actually telling me to do the extension course that you just mentioned.
Mm-hmm.
And I have been complaining, telling them I can't do it because every time I do it, I have a difficulty walking. I can't even touch the floor with my foot.
Yeah.
So I really don't know what to do. I have been also explaining to the person before that every time I try to extend my leg, the kneecap, it seems that it's kind of like it's blocking. I don't know if it's the tibia. It's blocking my leg to be extended. So I really don't know what to do. As I said, I have been going to one physical therapy to another, seeing different doctors, and I'm at the point of flying to South America to see another doctor there to see if I need surgery because there's something that is not working. I can't go up the stairs, down the stairs. I'm in my early 50s, so I'm young, and so there's many things that I can't do because of this. Yeah. And I don't know what's wrong. And I can't find the answers. I have been following you, and everything you say, oh my God, he's saying not to do this, and they're telling me to do it. Yeah. So, I'm so glad I'm having the opportunity to talk to you. And I said, wow, how can I see you? Where can I see you, instead of me flying to South America. Yeah. Because I really need help. Yeah. So that's my story, in a nutshell.
Great. So I have some questions for you, Beatrice.
Sure.
I just want to be clear. You said that you had the tibial plateau fracture and the partial ACL tear as well, and then you're trying to rehab from it. They're having you do the quad exercises, like leg straightening exercises, but you feel like a block is what you're saying. Now, did you ever have any surgery done since this accident happened?
No.
Okay.
No.
Okay, got it. So the tibial plateau fracture was not surgically repaired. They just let you heal. I imagine you were casted or braced so you couldn't move for a couple of months.
Yeah, I was braced for about 4 months. And then after that, the doctor, I couldn't even bend the knee. It was kind of like frozen.
Yeah.
So the doctor that saw me said that I needed to have aggressive physical therapy.
Yeah.
Or I had to go under, so that they could basically bend the knee.
Yeah.
So I chose aggressive. So when I chose aggressive physical therapy, basically it was worse because then I couldn't walk, and then they had to put the brace again. Oh. And I couldn't walk for 2 months again.
Jeez.
So it has been like a roller coaster. Yeah. And I have been University of Miami, Baptist Hospital, Doctors Hospital.
Yeah.
So I've been, supposedly really good doctors, but no. Yeah. Apparently not.
How is your motion currently? Like if you were to bend your other knee, can you bend it all the way? And then how well does the other knee bend? The same, or is it like 90%, 80% compared to your good side?
I'm gonna say like 80%. I can't bend it all the way because there is a lot of pressure inside the knee.
Okay.
So I tried to bend it and I felt pressure inside.
Okay, then
so
how?
I can't go all the way.
Got it. Got it. How about straightening it out? Do they straighten out the same, or is you're the one that you hurt? Does it not straighten out all the way?
So let me see. I can't straight the leg. I mean both, but I mean the left, which is the one that I have the issue.
Yeah.
It's hard for me to do it. It's like, wow, it's an effort, and every time I do it, like the patella, it's not tracking properly. So something is not right.
Gotcha. Gotcha.
You know?
And then when was I assume you had an X-ray, but did you ever have an MRI?
Yes, I had an MRI, and I forgot to mention it also showed chondromalacia.
Okay.
Grade 2.
Okay, got it. So then, evident to me, that's evidence of a muscle imbalance, likely, and that's probably what's going on. How are your glutes activating, Beatrice? Do you feel like you can activate them pretty well?
Yes. Actually, this started not so long ago because I couldn't. So now I can. So I have been doing like some good strengthening. Yeah. And trying like to tighten them, and now I can't. I mean, before, if you have talked to me maybe 3 weeks ago, no, I couldn't.
Okay, so
now I can.
You're just starting on that. You're a few weeks in. That's great. Okay, now let's talk about the physical therapy that you did, the aggressive physical therapy. Now, was it all exercise based? They just had you doing exercises there, or did they put their hands on your knee and they were doing stuff with their hands to your knee joint? Tell me more.
Right. Well, they were trying basically to bend my knee, forcing the knee to bend.
Okay.
So that's basically mostly the exercises they were doing, like pushing it back, and then they were working with their hands in my knee. But basically, it was forcing it. Even if it hurt really bad, they say to me, "We have to do this." The doctor said it's aggressive, and then I had bruising in the bone. In one of the MRIs. So that's why they told me, okay, now you have to stop and no walking, Yeah. That has been difficult.
That's tough. Yeah. Here's the thing. So the tibial plateau fracture is the biggest concern of mine because it's hard to know what the structure of the inside of the knee joint is like after that kind of a problem happens. And if you didn't have it surgically repaired, which is probably okay, then my thinking is that the doctor's probably thinking everything healed in good alignment, more or less, like good enough alignment. So we didn't need to go in there and put a pin in or put it back together the way that it should be so that your knee joint will work properly. So I'm assuming that that's the case. However, because that part of the joint, the tibial plateau, is the top of the shin bone, which is the bottom half of the knee joint, just showing on the screen for everybody. So this is the tibial plateau. So that's the break. Somewhere around here was a break. Could be in an edge or in the middle. But either way, that's going to affect the way the knee joint operates. And then being immobilized for months really shuts down how your joint operates. So what I highly recommend is finding an excellent, skilled manual therapist. Now, we do this here in our office. So if you're looking at flying to South America and you're in Miami, it's I think a much cheaper and quicker flight to El Paso, Texas, and we could probably make a big difference. I can't guarantee though how much of an improvement we'd have. But my suspicion is that if we did high level manual therapy, meaning like highly trained manual therapists are working on you, because everybody says they do manual therapy. Let me say this: every physical therapist out there, as soon as they're putting their hands on you, they say they're doing manual therapy, but there's different levels to the skill. Just like there's chefs out there. Like everyone's a chef, right? You all feed yourselves. you know how to make a meal for yourself, but there's some high level chefs out there. And that's kind of the idea with the manual therapist is they really know the joint and how to get it to move better, to bend and to straighten. And that's not something that's taught in regular physical therapy school. And so when the orthopedic surgeon gives instructions to the therapist to do aggressive physical therapy, what the therapist usually does is, let me just do this low skill technique. They're not going to say that to themselves. They're going to say, let me do this technique that I learned in PT school for 20 minutes, maybe practiced it a few more times after that, got tested on it and got checked off and passed my boards. Let me do that technique harder. Just, and that's not, you need different techniques. You need different hands, more experienced hands. To put it in perspective for you, like I went through my doctorate program in physical therapy. That was an additional 3 years after the bachelor's. Then I did a 5-year program in manual therapy. That is, and less than 1% of physical therapists will finish that program. Some start it, a lot of them start it, but half of them, oftentimes more than half of them, don't even finish the program because it involves, it's, you know, it's an extra expense, obviously, but it's brutal to say it short. It's hard.
Right.
So you might need, you need to find the right kind of therapist. And my title on my name is, after DPT, it says FAAOMPT. FAAOMPT. That's somebody who has completed that kind of training. So you might find somebody in Miami. You could come here if you want. Like, it's up to you to figure this out. But I would seek the help of a very experienced manual therapist who knows what they're doing, because it's just not normally taught. And no disrespect to the therapists that you saw. Yeah. I'm sure they're great at rehabilitating somebody after surgery. But Beatrice, you didn't have surgery.
Yeah, exactly.
And I would hate for you to go have surgery unnecessarily.
Okay. Yeah. See, that's what I would like to prevent, because the reason why I'm flying to Venezuela is, you know, probably ending like in surgery, because I said there is something wrong with my knee. So I prefer really to fly over, you know, at the clinic that you have, and and get somebody to help me, and then I stay there, you know, a little bit, because I really need help.
Yeah. It sounds like a fixable problem, but we need to get more details. We need to see the MRI, see the X-ray, like see how you move. There's more information to it. I can't, like I said earlier, I can't guarantee that we're going to fix you up 100%, but I think you'll gain a lot of clarity at the very least. And best case scenario, you'll probably say, wow, my knee's feeling tremendously better. So glad that I came to visit you guys, and I'm on the right path to normalizing my knee again.
Okay. So what are like the steps for me? I need to call and make an appointment and bring all my, you know, all my exams, all my tests, MRI.
Yeah.
But I ask for whom when I call?
Yeah. Let me just keep you on the line. I'll pass you over to somebody, and they'll take care of you.
Wonderful. Thank you so much for talking to me.
Absolutely, Beatrice.
Wow. Thank you, Dr. Davis.
No problem. It was a pleasure meeting you. Thanks. Bye-bye. All right, back to the video over here. Just to give a quick summary there, a knee injury, thank you, with a bone break and an ACL tear, partial ACL tear, and she's having trouble with the rehab afterwards. And this is what I mean. You know, what I said there is, not general physical therapists are great at helping people recover from surgery, but Beatrice didn't have surgery. And so usually they're using the same skills that they're great at helping people recover from surgery with to try to get somebody who didn't have surgery to improve, but it's a different skill set that's necessary. And that's what Beatrice is running into. And so she's looking at talking to orthopedic doctors, and you know, maybe they can help. I don't know who she's going to see exactly, but that situation for me, I've seen that situation many times. Tibial plateau fracture or some sort of fracture, they're braced because it's a fracture. They just can't move for a couple of months. Well, the bone heals, the ligament needs to heal too, the ACL injury, and it probably healed, but now the mechanics inside the joint are messed up. The cartilage inside the joint hasn't moved very much. And so that needs to, we need to guide the movement and make sure to restore all the motions. And that's something that a manual therapist like myself, the people we have on staff here, can definitely help with. But we have to get more details. That's a case where you need to be here in person for us to help you out, or you need to see the right kind of help in person. And sadly, there just aren't enough manual therapists out there. It is a true statistic that less than 1% of physical therapists in the United States have the designation of a fellow of the American Academy of Orthopedic Manual Physical Therapists, FAAOMPT. They're just far and few in between. And it's tough to find them. But when you find them, they usually are pretty good trained. Not all of them are practicing like this, like I'm talking about, where they're helping people avoid surgery. So it also depends where they're working and what their experience is. There's variables to this. But hopefully you guys that are in Beatrice's situation or something similar can have a little bit more information about how to navigate who to see with this information. Great. Coming back here. Great. Let's get on to the exercises that you should not do. So for number one, we said don't do quad sets, don't do knee extension because it violates this principle. Then hamstring curls, it's in line. If I had to do a principle number 4, would be avoid hamstring exercises. And that's why I wrote that one on here. But let's see what number 3 is. This is stretching. Ooh, stretching. Sorry, I'm misspelling words here. Stretching is not something I would focus on. Now, let me just say this before I get into it. It's not terrible. It's not like you're completely shooting yourself in the foot and making your knee arthritis tremendously worse, like quad sets and hamstring curls are, but it's kind of a waste of time, in my opinion. Now, that being said, if you stretch and you feel some improvement, I'm okay with that. I think that's fine. But chances are you probably stretch for a few minutes, maybe 10 or 15 minutes at most, and that's all you do. What people do, the kind of stretching that I'm talking about is when people get into the thinking that I need to stretch for 20, 30, 40 minutes daily, multiple times a day to improve my knee arthritis, that's not good. That is not good because stretching, low-level stretching for long periods of time is known scientifically to make you weaker. And we don't want to lose strength. We just want to gain strength in the right muscles, glutes. So we need to stretch appropriately. Now, if you have a stiff joint, it might help to stretch for a bit, but usually just a couple minutes at most. And people always pull out the excuse. They say, well, animals stretch. You see your dog or your cat stretch all the time, but they're not stretching for 30 minutes. They do 1 or 2 stretches. They stretch their legs out, stick up their rear, stretch the other way, and they move on. It's a quick thing. And I'm okay with that. I think that's fine. But you don't see dogs and cats doing yoga poses for an hour. And that's what I'm talking about. That's not necessary. There are better things to do with your time to fix arthritis than to stretch for long periods of time. So let me show you some common stretches that I see done unnecessarily. Number 1 is this one where people put a stretch strap of some sort. I'm using this bungee cord, but they'll have a stiff strap or a excuse me, a sheet or a belt that goes over the foot, and then they'll bring their leg up and they're stretching their hamstrings out. Now think about it. I just talked about avoiding hamstring curls because that dominates this muscle and it doesn't use your glutes as much. And so if you have tight hamstrings, it's usually because they're overused. So stretching out your hamstrings further is short-term thinking. You're going to make your hamstrings a little looser probably. It might help, but it's short-term. You're not going to get long-lasting hamstring length from doing this because the effects from stretching last hours at most. If you're lucky, 12 hours is what the research shows. I think 12 to 24 hours was the longest I've heard, but I've often heard patients say, yeah, I stretched and I felt better for like a couple hours. Then it got stiff again. Then I stretched again, and then I realized that I'm just stretching all day long without really getting any long-term benefit. Another stretch you'll see people do. Sorry, I got a dry throat right now. Is they'll be on their back like this, and I don't know if I'll be able to do it. Oh, I think I can if I make a loop. They'll tighten something around their ankle like this, and then they'll pull their knee into bending over their shoulder like so, and they're stretching their knee into bending. The idea is to stretch the quads. And like I said with the hamstrings, your quads probably feel tight because you're overusing them. That's the root problem. So stretching a stiff, tight hamstring is only solving the superficial problem. We need to address the root, which is why is the quad so stiff and tight? Because it's being overused. How do we use the quad less? We got to use the glute. So the problem is really back here and not here. This is a secondary thing. It's an inactive, weak glute that is setting up your quads to work too much. And then another stretch that you see people do is leaning against the wall, and you have to go down here, putting your heel down to do like a runner stretch. And the idea here is to stretch your ankle out and your calf muscles. And that's okay, like I said, for the short term, but not something that I would do in the long term. This is going to build you up some momentary flexibility, but it's not solving the arthritis problem. So stretching is very short term. It's not going to fix the long-term problem. All right, number 4. Oh, this is a PT clinic favorite. Wall sits. This is a direct quad exercise. And the way this one looks is you find a wall, you lean on it, and then you sit. You slide your body down and you hold this position as if there was something under your bottom here, so that like you're in a sitting position, but really you're pushing your body up against the wall, which makes these muscles here work a lot, and that violates that principle of activating your quads too much. You're strengthening your quads. We're trying to avoid that. And what you're not doing here is strengthening your glutes. So we're keeping you in an imbalance where your quads are already strong, and now by doing wall sits, we're just keeping your quads even stronger, and you're not doing anything for your glutes. So I strongly think that wall sits is not a great idea if you have knee arthritis. It's going to move you towards getting a knee replacement. All right, number 5. What do we have next here? Step ups. Step ups / stairs. So you see people do this in the clinic, in the PT clinics all the time, where they'll find a step stool or a step, or sometimes they'll have like 3 or 4 steps built in somewhere, and they'll have you just step onto the step and straighten up and step up. Losing my balance, and then come down. So just step up and step down. The idea is to practice stair climbing. But guess what? If you have not focused on which muscles you're using to accomplish this motion, and you have knee arthritis, chances are you're probably going to feel these big quad muscles do most of the work to straighten out your knee as you step up, which turns this into a quad exercise. And very often, if you have not been offloading, your knee's hurting you, and you have not been offloading, your knee's going to hurt even worse when you're doing this, because it's directly putting a lot of compression through your knee joint. And you'll have rails often when you're doing this, or some sort of balance thing, and people will tell, like therapists will tell you, hold on to the rail and get yourself up. And what the therapist is thinking is, this is a practical movement that this person needs to do, that you need to be able to climb stairs. You need to be able to step up on a curb or step off a curb. That you're going to encounter that in life. So let's practice it, and let's teach you to do it right, and let's strengthen the muscles that do it. But what the therapist is not thinking is, let's teach you how to use your glutes while you're doing stairs. And what they also often don't think about is, if it hurts, maybe we should come back to stairs later or step ups later and first spend some time offloading. It's not always done though, because the normal therapist is usually saying, oh, we just had surgery. Great. I help you with that. That's what I do. That's what I'm excellent at. You have stairs at home, or you have curbs all around you in life? Let's practice going up and down stairs and curbs, because you just had surgery. I see the stitches on there. You need to be able to do it soon. You're going home soon, or you're already home and you're having trouble getting around. Let's practice some. And you're recovering from surgery. But if you're not recovering from surgery, you're trying to avoid surgery, let's fix muscle imbalances first. We'll get to the stairs eventually. That's what I tell people. All right, so step ups, stairs, let's avoid those, please. Number 6. This is it's got different names. I'm going to give it a name here, but you guys have probably seen different names. I'm going to give it a pillow squeeze name, but sometimes people use a ball or other devices. And what you're doing here is squeezing a pillow between your knees. And the point is to work out the inner thigh muscles. So they'll fold the pillow very often, put it between the knees. You're lying down with your knees bent like so, and you're instructed to squeeze the pillow together, maybe hold it or maybe do reps. But the point is to get the inner thigh muscles to activate and strengthen. And the rationale that I think most therapists are thinking of whenever they're issuing these exercises to patients for knee arthritis is to strengthen everything. So they'll have you do the knee strengthening exercises, the hamstring curl exercises, and then they'll have you move your leg out and in. And this is an in motion that strengthens these inner muscles. But what you have to realize is that when you over dominate these inner thigh muscles, like with the quads, like with the hamstrings, these inner thigh muscles can compensate for weak glutes. So if you don't strengthen your glutes and you strengthen your quads, you remain, your groin muscles, your inner thigh muscles, you remain in an imbalance. And it continues to pull your, remember I drew this nerve right here? It's going to pull your knee inwards because those are the inner thigh muscles. They pull your knee inwards, and it's going to feed into the movements that set up bad mechanics at your knee joints and cause extra pressure to build up, and you don't use your glutes very well. Then it tensions your nerves, sets off this nerve right here, the genicular nerve here, and then it can increase the pressures behind the kneecap because it's shifting off its place because of these over dominant inner thigh muscles. Doing exercises like this where you're squeezing the pillow, sometimes they'll put a ball and you're squeezing the ball too. All right, so what's next here? Oh, I love this one. What I mean is I love to pick on this one. I get so fired up with these exercises because I've seen therapists doing these. When I was a student, they'd be doing these exercises for decades without clear thinking about what they're doing to patients. So it's the 4-way hip exercises. And the way this looks, they'll do it in standing, they'll do it in lying down as well. Let me show you the lying down version. So the idea is to strengthen your all the muscles in your hip that move your leg in 4 different directions. The first one's going to be bringing your legs straight up. So these are your straight leg raises is what they'll call it. And they'll have you do reps of this, 10 reps, 20 reps, 30 reps, whatever the therapist assigns you. And so that's one way. Then the second way that you're doing is usually you turn on your side and then you're picking your leg up this way. So you were going forward earlier, now you're going out to the side here and you're working out muscles on the side of your hip here. Then the third way they'll have you do is then pick up your leg this way, lift it backwards. Then the fourth way, this one I like as long as you're using your glutes, but the other 4, not so much. So I'll have you move your legs this way and then pick up your leg this way to move your inner thigh. And these motions are so, like this one especially, it's so awkward. People are always like, that's weird. I never do that. It's impractical. You just don't do that motion very much. But the therapist is thinking of a way to strengthen all the muscles, and this kind of does it, but they're not thinking about the imbalance. They're just thinking, let's strengthen everything. So that's the lying down version. The standing version would be that you hold on to something for balance. I'm going to get the walker. You don't have to use a walker for this exercise. You can just use a piece of furniture or something sturdy. But the idea is you have something stable for balance, and then you're moving your leg forward this way, out to the side this way, backwards this way, and then across your body to do the inward motion. You could go either in front of yourself or behind yourself. It's whatever's more comfortable for you. But I don't like this one because there's no glute strengthening unless you're consciously using your glute on the backwards one, which very often people are just moving. Go up a little bit so you can see my back. People are moving their leg back, but if you look at my back, you see the curve in my back, I see people doing this. They're extending their back, they're arching their back more than they're using their glutes, which is a compensation because now you're using your back muscles up here, skipping the glute muscles, and even using your hamstring because they're bending the knee. So you're missing the exercise. And very often I see that people are not slowed down when doing this exercise to be told to use glutes and to avoid quads. They're just telling them, do the motion this way. And whatever muscles activate. It's just willy-nilly, in my opinion, and it misses the mark, and this is why people end up having worse pain. All right, so that's the standing version and the lying down version. All right, guys, let's answer some comments and see where you guys are at on this before we wrap this up. See if we can take any more calls too. Or does it help? See in a minute, I guess.
1 second.
Okay.
Hold on.
Oh, sound. Oh, now we're working? No sound. Julie says no sound. Okay. Looks like we're back. Still fixing audio. Okay. Can you guys let me know if you can hear me? Works now. Somebody said works now. Sound is back. All right. All right. Sorry about that, guys. Troubles of live broadcasting. We're going to answer comments. Let's get on comments. Thank you for those of you guys that stayed. And those of you guys that left, shame on you guys. Give it just a minute. It's just a quick minute. Once in a while, we have a glitch. We're getting better at this little by little. Thanks to our media team who is so good at fixing all these little problems. Mary Boggs says, I find it so difficult to activate my glutes. Yes, Mary, that you're in the vast majority of people that have knee arthritis. You're not alone. It happens so often. It's the number one problem, in my opinion, that leads to knee arthritis. This happens all the time. Oh, she has another comment. I purchased this program a while ago, but have not finished the program. Have you made an updated one yet? Yeah, we have. I don't know when a while ago was for you, but we're on version 3 of the knee arthritis recovery program. We released like a standalone program a while back, then we upgraded a lot of things to it. Now it's a membership, and we've made some more upgrades since the first upgrade. So it is extremely better. And if you are just starting out, Mary, what I would recommend if you're not a member of the program where you have a membership is go to our website, and we have phase 1 of the program for free so that you can implement that. Now, if you feel like you're doing that stuff and you need some extra help, the extra help that we offer as a part of the membership is we have a private community as well as weekly group coaching calls and weekly office hours. We just have a lot more support available as part of the membership. There's other features too that I haven't mentioned, but those are like the big ones that everybody talks a lot about. But finding how to activate your glutes is a milestone that you have to attain in order to successfully avoid a knee replacement. And avoiding a knee replacement, in my opinion, that's just surviving, right? Like that's just, okay, I'm good enough to not have a surgery. But if you keep going, if you go through the phases of our program all the way, because for most people, phase 1 is when you're miserable. It sucks to do anything every day, most days of the week. By the time you're in phase 2, you're feeling a lot better, but you still hurt. Phase 3, this is where people say, I don't need surgery anymore. I'm confident that my knee is feeling better. I have much better strength. My strength's improving. I have momentum. And by the time this is surviving, you got to the point where you survived surgery. You survived avoiding surgery is a better way to put it. But there's still another phase here. Phase 4 is when you thrive. People in our program are doing amazing things. They're getting to hiking miles and miles. I mean, like camping out overnight. They're getting back to the simple things too, like being able to do all their chores on their own. We had one gentleman who was just happy to be able to rake his own leaves. Something simple, right? I mean, you take it for granted though when you can't do it. All of a sudden, it's like, I wish I could do my own yard work. I wish I could do my own laundry and cook a meal and enjoy my family. Those things, it's nice when you get them back and your knee pain isn't anything that slows you down. So fixing the glute activation is critical first step. There's other milestones we talk about in the program, but I highly suggest you go check out phase 1 for free and then see if you need more help after that. Great question there. Who else is with us here? We have Caroline Shipsy who says all those features in so many exercise programs. All those feature in so many exercise programs. I've done them for years. Great. Oh, the ones that I was demonstrating, I see. Yes, these exercises that I've written out, they've been done for decades, and that's why we haven't figured out how to solve knee arthritis without surgery. People instead, we figured out how to replace a knee joint, and so that's what everybody does, and that's what the medical field pushes us towards, and it's very profitable. All the people involved in the surgery and I don't even want to get into that, but it is extremely profitable to do joint replacement surgeries. I'll just say it that you can investigate it and see how much money people are making and how lucrative it can be. But it is very helpful for some people, but I also think it's very unnecessary for a lot of people. Julia says, what should I do? So what should I do? Oh, okay. So I'm talking about what not to do. Julia, there's a lot of glute exercises to do. I recommend starting with our free phase 1. Number one thing you should do is if you're doing any of these exercises, stop. Don't do those exercises. Go figure out how to tighten your glutes. And the number one thing to do with that, I'll just give it to you right now, is wherever you are, Julia, standing, sitting, lying down, whatever position you're in, just think to tighten your butt muscles, your glutes, and don't tighten your thighs. And hold it for 10 seconds and see how well your glutes can tighten without other muscles activating as well. And can they make it 10 seconds? And think of the percentages. So I'm doing it right now in standing, and I can go 100%, but maybe you're at 50% and then your thighs kick in. Back down a little bit to maybe 40 or 45%. Fire your glutes without your other muscles working. And as you practice this, then you begin to creep up to 70, 80, 90%, closer to 100. And that's where you can start to really use your glutes well. Then you've got to learn how to use your glutes in exercises. And if you're in pain right now, you shouldn't even be worrying about your glutes. You should be offloading. That's what I talk about in phase 1 for free. On our website, where we have phase 1 of our program, I talk all about offloading and a bunch of other things you can do to get the pain under control. And I do talk about how to activate your glutes. It's all there laid out for you on what to do. There's a bunch of other pain relief techniques that are non-surgical, non-medicinal that I talk about as well. So there's plenty of things to do, Julia. This video here is I'm focusing on what you should avoid, what you should stop doing, because this is the mainstream stuff. This is what everybody talks about doing, and it's just making you worse. All right, number 8. Let's keep going here. Number 8. Cycling. I'm going to put /walking. And we could call this cardio exercise, but cycling and walking are the two common ones that people mention. And here's the thing. You go to the doctor, you go to the physical therapist, they will have you cycle or walk in physical therapy. And the orthopedic surgeon will often recommend walking or cycling for your knee arthritis. And they're doing that because there's research studies out there that have shown some improvements with walking and cycling. But they're incomplete in my opinion. The walking studies in specific, they show that there is an improvement in knee pain in people that have knee arthritis. They're trying to avoid a knee replacement, up to walking around 5,000 steps, give or take 1,000 steps. But then once you get closer to 10,000 steps, which is what we're recommended to do, knee pain tends to increase. Why is that? And doctors aren't telling you this. They just are telling you about the improvement part. But if you keep going, it gets worse. It's like you hit a dead end. The reason is because the imbalance hasn't been fixed. Maybe you started out with walking through pain, you haven't offloaded. So, okay, maybe you do that and you're walking without pain. But are you activating your glutes while you walk? Have you figured out how to activate your glutes? If you haven't, then you shouldn't be walking, because when you go walk, you're using your quads and your hamstrings too much. And the pressures are increasing at your knee joints. And yeah, you could take 4,000 or 5,000 steps. Once you hit 8,000, 9,000 steps, the pressures are too much in your knees, and that's why they start to hurt. And it's the same thing with cycling. Cycling is a very quad dominant activity naturally. You have to consciously think about tightening your butt muscles when you cycle. And the way you can do it, this is for Julia. Julia was asking, what should I do? When you cycle, when you push down the pedal, if you're pushing down your right foot, your right butt cheek should tighten up, not your right quad. Now, it's okay if your quad activates some, but it should dominate in your glute. Your butt muscle on that right side should be tightening to push your leg down. And then as you cycle down on the left side, the left glute should tighten to push that side down. And so as you're cycling, you're just revolving around the pedals, you should feel like your glutes are just alternating contractions to straighten out your leg. And it's the same thing that should happen when you're walking. When you bear weight on your right foot and you're leaning over, let me show you on this side over here, as you step forward and you're putting pressure onto one leg right here, the right glute should tighten up, which means you have to have practice firing your glutes and not activating with your thighs so much. And then you should step with your left foot and your left glute should tighten up without the thighs taking over. So walking should be glute, as I'm leaning over to this leg, and then glute as I'm leaning over to this leg. And you should be very conscious and deliberate about it, but you need to eventually get to the point where it's automatic for you, for the most part. You might still have to remind yourself from time to time. I have to remind myself from time to time. I went on a 3-mile run today, a 5K, and I was reminding myself during my run, glutes, 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 because I'm listening to something else. I'm listening to an audiobook, and I'm distracted with the thoughts of the book, but I'm still moving. I have to think about what my glutes are doing during my run so that my knees don't hurt. You know what reminded me to fire my glutes? Is I felt a little twinge of knee pain. And as soon as I started firing my glutes, knee pain went away. And I finished my run. I felt it about 2 miles in. The stuff works. I've tested it myself, on myself, but I've tested it on a lot of patients in person. And we've had so many people on our online programs and people that are just watching our videos, following us on YouTube and on Facebook, those on Instagram as well. And when they apply it properly, it really works. So cycling and walking, I don't recommend unless you know how to fire your glutes. Because if you don't fire your glutes, by default, it becomes a quad exercise, and you should be avoiding quad exercises if you're trying to avoid a knee replacement. Stay away from cycling and walking until you figure out your glutes, please. All right, number 9. Oh, do I want to talk about this one? Yeah, let's do it. Sit to stand. Super common exercise that is given in physical therapy. And it's so easy to do. I feel, physical therapy clinics are often, there's too many people in there for the therapist, and they're just kind of giving people exercises. But this is one of those that I see therapists sometimes just say, just tell them to do sit to stands. They're telling their help. Send them to sit to stands, or put them on the bike, or put them on the treadmill. And it's more so to do something that they think is productive, but kind of gets them out of their hair. But the reason why I don't like sit to stands is because the teaching, the way that it's taught to patients all the time is they'll have you sit down in a chair very often. This might be a little higher than normal, but all you're doing is you're standing up and then you're sitting down. And they'll tell you to do that for 10 reps, 20 reps, 30 reps, however, or for a timer, and just practice standing and sitting. And the idea the therapist has is this is a practical thing. You stand up and sit all the time, so let's practice it and let's get stronger at it. But what isn't taught is which muscles to use. And if you're not conscious of it, you're using your quads to straighten out your knees as you stand up. But what should be happening is when you're putting weight onto your feet right here, you should be thinking, I need to activate my glutes to push my hips up over my legs rather than push my knees behind my body as I stand. It's that little shift. The motion looks nearly the same. I'm standing up or sitting down, but which muscles you use makes a big difference because it impacts the pressure through your knees. And in one rep, it's insignificant. But if that's the way you move all the time and you do thousands of standing and sitting movements, it now becomes very significant. Just like with the walking and cycling, it's thousands of reps. And if 80% of your reps are with glutes, you're depressurizing your knee joint and saving yourself from arthritis. So sit to stand is just poorly taught. I don't know that I never got an explanation of which muscles work when I was in school. I had to figure this stuff out on my own. All right, number 10, I actually have an 11. So we have one more after this. Leg press. I have to include number 11 because it's a common one that you guys get, but leg press is a common one too. And there's machines that are leg presses, but the way that I see physical therapists do this one without the machine to make it lighter is they'll get a resistance band like this. They'll have you sit down or lying down. I'm gonna do this, I'll do both versions, but let's do the sit down version. You'll hold on to the bands. It doesn't have to be a tube. It could be one of those flat bands, but you'll hold on to the band like this, 1 foot usually, and then you just press out like that. And you can see when I press out like that, I'm straightening out my knee, which whenever I forcefully straighten out my knee, I'm working out my quads. I'm working out my thigh muscles. So it's a quad exercise. Violates one of the principles here. You're not using your glutes very much. The machine that you'll see in the gym, they'll put plates on the sides of it or on top of it. There'll be a place to add plates. They usually sit in with your back supported here. So because your hips are bent and you can't extend your hip, you can't really use your glutes. It takes your glutes out. And really you're focused on using your knees to straighten out, which activates your quads mostly. So then the way the exercise looks lying down with a band is like so. Very similar to the one sitting down. You're just pushing your legs straight. That's a leg press. And it's very, very quad dominant. Not a great one to do. But the idea is you're working out your quads, which is what most therapists are excellent at showing people because they help people after surgery, and activating your quads is important if you had a nerve block that shut down your quads. But if you did not have surgery, you didn't have a nerve block, so we don't need to worry about quad strengthening. Very common sense, but it's just not commonly thought of. All right, 11, secret one here. Let's put it right here. I put an H. Number 11 is standing balance. Oof, this one gets under my nerves. Under my skin, it gets on my nerves. And all it is you're standing and balancing on one leg. And you might be on a foam pad. You might be without shoes on, with shoes on. That's it. You're holding onto something for balance if necessary. And you can see I can balance here all day long. It's not that difficult. And you might have a balance problem, but a balance problem is going to show up for you if you have weak glutes or inactive glutes because you're using your quads all the time. But if you balance on one leg, it's, improving how well you can balance. But how does that translate to fixing your knee arthritis? Here's the thing. There was a few studies done back in the day where they figured out, maybe 10, 20 years ago now, I forget the exact dates, but they tracked knee arthritis pain, knee pain in people that had knee arthritis, and people that worked on balance exercises like this, after a period of time, had an improvement in their knee pain. Here's the problem that I found, because I've done this exercise with patients, is there's no instructions on which muscles to use, and I think glutes are pretty important to be using. And it's possible for you to balance on one leg and activate your glutes, which is good. But if we're trying to fix an imbalance, as far as, let's not confuse terms here. We're trying to fix a muscle imbalance. What I mean by that is one muscle's way too strong and another muscle's way too weak. Therefore, there's an imbalance. That's different from fixing your balance problem because you fall. I'm not talking about the same thing. If you're doing a standing balance exercise with an intent to improve your knee arthritis, it is not promoting enough strengthening as if you were to do, say, like a mini squat. So let me show you over here what that looks like. Like if you were to do squats like this using your glutes, or if you were to do, this is for you, Julie, all the exercises you should do. Bridges where you're thinking about using your glutes. It's another one. Or I like to show people, I call them butt burners. Some people call them fire hydrants, where you're tightening your glute and holding it right here. There's different, you can do it on different sides. We do one at a time. Eventually, walking can become a glute exercise if you're using your glute muscles well. I would rather you spend time making your butt muscles burn and fatigue against some resistance, because if you can improve that muscle balance, you're going to take off the pressure in your knee joint. And it usually, I say usually in really every case I've worked on, so 100% for me, my experience has been that those people that improve the muscle imbalance have better standing balance without ever working on standing balance. Let me repeat that because that's really important. You don't need to work on standing balance. You need to work on glute strength because it improves glute strength enough to improve your standing balance without working on your standing balance. Improving the glute strength depressurizes the knee joint, which just makes doing anything on your feet easier. And having that extra muscle, that extra strength, physical strength, in some cases you'll put on muscle, you'll put on meat on your body in a good way, and it translates to better balance. Without working on balance, without like standing on a foam pad for 30 seconds trying to not teeter-totter too much. So it is hugely valuable for you to just strengthen instead of working on your balance. Now, I'm not saying don't work on your balance ever if you feel like you really want to or you like to, you can, but it's not the best use of your time. I would rather you spend 5 minutes of glute work instead of 5 minutes of balance work. And if you have time to work both, great. Just make sure that the time that you put into working your glutes, you really fatigue your glutes because you have to get it above a certain threshold to push strengthening in the muscle. Otherwise, it wasn't enough exercise. So that's my list, guys. Let's see what questions you guys have next so we can help you out. Let's make sure you don't get stuck here. All right, let's got a lot of comments here. Nelson says, I have a meniscus tear. I've been in physical therapy and I still have pain. Do I need more time to recover? Thank you. Sincerely, Nelson. Oof. I don't know how much time you're putting in. It's hard to know. A meniscus typically takes the better part of a year. I'd say 6 to 12 months. So the majority of the year. You should feel like you're making gradual improvements. If you feel like you're stuck, like it's plateaued in improvement, something needs to change. If you feel like you're getting worse, something needs to change. If you're consistently making improvements, and it won't be massive improvements, it's usually just like, oh, I walked for 5 more minutes this week compared to last week. I noticed last week I started feeling pain around this time, but I feel okay. And then I felt some pain. That's an improvement. If you're still making improvements, then I would keep doing what you're doing. But if you're not making improvements, something needs to change, Nelson. So I would keep going with trying to figure that out if you haven't yet. Sherry says, how often do you do these exercises to get relief? I've been to PT, only lasts a few months after that. I guess I'm asking, is this a lifelong exercise program? Great question, Sherry. When you go through our program, the knee arthritis recovery program, here's the thing. We don't have a time frame on this. We have ranges that we typically see, but you may not fit into that range. So we often see people last about a month or so in phase 1, 2 to 6 weeks, we'll say, with an average of 4 weeks, and probably spend a little bit more time, more like 4 to 8 weeks in phase 2. But it can differ. Some people are here for 3 months. Some people are here for 1 month. Some people are here for 2 weeks, 1 week even. We see people go really fast through this phase. But to answer your question of when you get to the end and you're feeling great, do you have to keep doing stuff for the rest of your life? Yes. But what you're doing here at the end is usually just maintaining a typical exercise routine. Like we tell people, you should be going on walks for exercise and doing some simple weightlifting exercises. It doesn't have to be super big weights or heavy weights. If you want to pursue that, you can. But there's a few things you have to maintain. And the main thing is using your glutes during that time. And if you're not a big exerciser, you're not somebody who wants to carve out time. I've seen people just do walking routines and they go for a walk. They walk for their typical activities. They do their chores. But if you're using your glutes properly, you're getting a workout in, and that can work for you. That might be appropriate for you. That's how you maintain without having to do special weird exercises. Just get your glutes active and make sure that they're working for you. Hope that helps, Sherry. We have a 2-part question. Patty says, what other exercises can we do for strengthening the quads? I recently had the cortisone shot in both knees, lasted almost 2 months. I refused to get the knee replacements. Patty, is a rebounder a good exercise for knee arthritis? Patty, no, don't do the rebounder. Don't work out your quads. Patty, go back and listen to me. Go back to the beginning of this talk and listen to me. Do not strengthen your quads. I wrote it here. Avoid strengthening your quads. You shouldn't be working out your quads. But see, I get where this comment might be coming from. You might be worried about, well, I should be doing something for my quads. But here's the thing, you are. Every time you walk, every time you get out of bed, every time you move with your legs, your quads are working some. Your quads are just very strong right now. So we don't need to do anything extra beyond what you already do naturally. What we need to do extra is on the glutes. We need to get these glutes up by doing extra work. That's why I wrote, do activate the glutes, do work the glutes here, but avoid strengthening your quads. That doesn't mean never ever use your quads ever again. It just means don't do anything extra to strengthen your quads. So don't strengthen your quads. They will come along for the ride and they will work and get a workout and eventually strengthen along with your glutes, but just focus on getting your glutes stronger. That's going to solve the problem. That solves the problem for a lot of people. That's why regular physical therapy where they focus on quad strengthening, it doesn't last long. That's why people that start a walking program and after 5,000 steps, I've worked up to walking a mile, 2 miles. I'm feeling great. Knee arthritis is getting better. Then they get 3-4 miles, not so great. My knees are getting worse because they're doing too much activity that's now compressing the knee joint. They're working their quads too much. They're already worked out too much. They're overdoing it. Stop working out your quads, please. Sorry, I didn't mean to get mad. I'm not mad at you. I get worked up about this because I want you guys to understand. I want you guys to solve your knee problem, not have surgery. Lovely Jubbly says, like maintaining your car. Yeah. So you could go off that analogy. Building a car is work. Think about constructing a car in the factory. It is a heavy labor job. I'm sure a lot of machines are involved, but it is a lot of effort to build a car. But car maintenance compared to car construction, vehicle construction, it's a different story. In your case, if you have very weak glutes, we kind of have to build up the glutes and it's a lot of work. But once you're at the right balance, then it's maintenance. It's not as much work. I love that analogy. That's good. Sheila says, does the pain location tell you about the imbalance? My pain is on the inside at the meniscus. Yeah, it does. I really think that when that inner knee pain is because the knee goes in, like I was drawing on my leg with the nerves, the glutes getting weak causes the knee to fall in. And so getting inner knee pain is a very common symptom. Some people do get outer knee pain, but I see inner knee pain way more common. And then with the arch of the foot falling down, that can also contribute to the inner knee pain, the knee coming in. Maria says, almost 5 months into doing your exercises and excruciating knee pain and problems have diminished 90%. That's awesome, Maria. Every hour I do some exercise though, hard work, a lifestyle now, but huge payoffs. Yeah. And see, you're in the middle of building up the strength, which takes a lot of effort and doing hourly exercises. In our program, those of you guys that are in it, chime in, or those of you guys that have done it in the past, we usually tell people in the first couple of phases here, there's very frequent exercises to be done to the point where it's hourly. It's another big difference from regular physical therapy. Regular physical therapy, you go do the exercises with them once a day, a few times a week. And they might give you a handout to do exercises at home. And they'll maybe instruct you to do that once a day when you're not in therapy or an extra time when you are on days you go to therapy. I am telling people in phase 2 heavily, at the end of phase 3, at the end of phase 1, we begin, but heavily in phase 2, we are doing hourly exercises on the glutes because we have to wake them up and get them stronger to build them. But once you're out of the phase 2, then it becomes less frequent here in phase 3. It's more like once or twice a day. And then here in phase 4, it's a few times a week, maintenance work. But just because it's maintenance work doesn't mean it's super easy. We still challenge people. We tell people, you need to make those muscles burn. You got to build up a sweat. You got to get tired. If you didn't get tired, it's kind of a waste of time. That was good. Patty says, how do I find local physical therapy that will help me avoid knee replacement surgery? What should I ask for when starting therapy? That's a tough one, Patty. We've stressed about this a lot because I want to refer to my colleagues as much as possible. But the fact of the matter is a lot of them just aren't experienced in helping people avoid surgery. The best litmus test you can do is if you go to a physical therapy clinic, you can go into one before signing up with them just to see what's going on and ask questions, just inquire. And you can even talk to the patients if they let you, which most places probably will, and ask them, how's it been here? And if you just look around, if you ask a few people, and if you get an idea for if they're there for surgery recovery, they're there for rehabilitation after surgery, if that's the majority of the cases that they see there, it's probably not going to work out for you if you're going to help avoid a knee replacement surgery. because they're going to have you do the same exercises that they would have somebody who had surgery do. And that doesn't work to avoid a knee replacement. It's a different specialty. So you got to do some research. You got to find out. I highly recommend doing our online program. That's worked for a lot of people. But if you're the type of person that you need to go somewhere in person, then you're going to have to do some researching, some digging around, and see what you can find. Hopefully your town has somebody who's qualified and capable. Tina Mitchell says, do you have special advice for obese people starting out or trying to avoid knee surgery? Yes, I do. If you are obese, so in our program, we have a BMI cutoff. BMI is a body mass index. It's a ratio of your height to your weight. And so if your BMI is 35 or higher, do we have the chart? I think we might have it in our files here. Yeah, here it is. We're showing it to you here. Cool. So you can see here the blue line, the blue section on the bottom of the graph is underweight. We can work with you if you're underweight. If you're in the green section, that's normal. We can work with you there. Even if you're in the orange section, overweight, we can work with you. And even if you're in the first band of the obese section, 30 to 35, we found that people still get improvements. But after 35 and up, if you're 40, 45, or 50, we have found that it would be better for you to focus on weight loss so that you can get your BMI down. You can bring me back on. Under 35, get under 35, and then you can work with us. You can do this kind of rehab. And the reason for it, it's mechanical. It's purely mechanical because when you have extra weight on you, that does put more pressure through your joints. But the thing is, you can overcome the pressure. If you can fix the imbalance to some degree and depressurize your knee joint if you're still in the right weight zone. But if the weight's too much, it's going to be more beneficial for you to drop the weight than to work on the imbalance. Now, some people defy the odds, but we've seen that be the case largely. So we've made a cutoff. If you're 35 or higher, we recommend you go talk to a nutritionist or you go through the right measures, talk to your doctor about losing weight, whatever is right for you, and drop your weight down. Once you're 35 or under, then doing our program is highly recommended at that point. We've seen great success of people in the lower 30s, 30 to 35, and then below that, they're also doing fantastic. So I would highly recommend dropping some weights. And there's all kinds of options out there. You just have to look. Great question there. Amanda says two parts. I had a Baker's cyst drained a few months ago. Yep, they do that. I started doing glute exercises last month. Good job, Amanda. I've noticed a clicking in the front of the knee if squatting or extending the leg out. Is this an issue? Okay, we'll talk about it. Also, if I do something like active like tennis, the next days it hurts behind the knee. If I try to squat or lunge, does this mean I'll have a Baker's cyst forever and be in pain? Okay, got it. When you feel the clicking, when you extend your knee or with squatting, it isn't necessarily an issue unless there's pain with it. You're probably going to always have some sort of noise come out of your knee if you have knee arthritis. I have noises come out of my knee. I don't have knee arthritis. Like it's normal is what I'm trying to say. It happens to people at different ages. My kids have noisy knees. My son, he's 13 and he's clicking and popping every time he stands up for the first few steps. He's got dad's genetics. But as long as it doesn't hurt you when it pops or clicks, I'd say you're good. It's just, to me, what I take it as is there's some sort of friction happening inside the joint for a variety of reasons. I won't get into it right now, but it's making a noise when you hit the friction, when you unlock a joint or when there's a bump inside the joint that you pass over. Now, as far as answering your Baker's cyst question, if you probably have an imbalance, that's probably what set up the Baker's cyst. If you haven't fixed the imbalance and you go play tennis, you're not used to using your glutes properly because it's a dynamic activity. You're probably re-aggravating your knee joint from the imbalance still being present, and you're probably going to refill your Baker's cyst and potentially get it drained again. The problem isn't that the Baker's cyst keeps coming back. That's the medical mindset is, well, it's a Baker's cyst. They see it as different than knee arthritis, but it's the same. It's the imbalance. The problem here is that you haven't fixed the root problem, the muscle imbalance. And if you fix the imbalance, your knee joint will probably be able to better tolerate tennis without the back of your knee getting sore because the fluid's starting to build up gradually back there. It goes back to the imbalance. And tennis is a high-level activity. You probably need to take a break from tennis or back down, see if offloading is necessary for you. Definitely get your glutes activating. And if your glutes are active and you can activate them left to right, you can do all that basic stuff, then the next step, it's what we hit in phase 3 of our program, is do you have enough glute strength to tolerate the activities that you like to do? Because if you do have good glute activation and you probably love playing tennis, chances are halfway through your tennis time, your glutes check out and they're like, I'm done. That's all I got. Then your quads take over, your hamstrings take over, and that's what's pressurizing your knee joints and causing that knee pain. That's what often happens. Hope that helps, Amanda. Oh my gosh, Dr. Lyons, thank you so much. I appreciate that. She says, thank you, Dr. Dave. These lives are invaluable. She gave us a super chat. I appreciate it, Dr. Lyons. Thank you so much for that. I'm glad that they're invaluable for you. I hope they're helping everybody. I hope none of you guys have an unnecessary knee replacement. Some of you guys are going to have one. There's a small percentage of you guys that are out there that there's just no way around it. But I think a lot of you guys are going to avoid it if you follow some clear advice, if you follow these principles, if you offload properly, get the glutes to activate, avoid strengthening the quads, and you study this stuff. This takes, like you guys, somebody was talking about taking notes. Dr. Lyons has been here consistently. There's some other of you guys that are regulars on here. I've seen Kimberly here regularly. Cindy, who else is here? Our Australian friend here, Julie Parker. You guys, because you're here absorbing this information, this isn't a one-take thing. This isn't like okay, I saw one of Dr. David's videos. I get the gist of it. There's layers to this. Like we homeschool our kids, and you don't learn how to read in one grade. You learn how to read through elementary school. 5 years, first, second, third, fourth, fifth grade. It's layered on. And I think it's the same idea with fixing knee arthritis. It's not one round of physical therapy that's going to do it. It's learning how to get all this stuff sorted out in your head, how to apply it to your life specifically, and how to continue to do this for the long term. That's how you save your knees and other joints that are related to the same problem: hip arthritis, back problems, ankle and foot problems. So I love that you guys are here regularly learning this stuff. Thank you, Dr. Lyons. I appreciate it. There's Cindy. She says, I don't like that BMI chart. It says I'm obese. I do not feel obese. You know what? It says I'm obese too. And I do have some padding that I could get rid of. But truthfully, you guys have to look at this chart with a grain of salt, because if you are a muscular person, I lift a lot of weights and I look like a football player. I'm not scrawny. I'm not a small person. I'm 6'2". The more muscle you have, the higher it's going to put you on the chart and put you into the obese range. Like whenever you see a bodybuilder, like those guys that wear those little tiny bikinis and they're on the stage, women too, they're obese according to the BMI chart, because for their height, they have a lot of weight on them. So it puts them in that chart. So you just have to understand this. And so if you're looking to apply for one of our programs, because we're telling you that you're obese, just reply back to us and let us know. I got some muscle on me, so that's why I'm obese on the BMI chart. But it's a good measure for populations. And some of you guys, you got to face the music. It's time to maybe really do something about that weight, because it's going to limit you on your healthcare options, because the weight keeps becoming a problem. But I know, Cindy, I know what it is, and you just you have to deal with this. You have to face the weight problem head on. You have to, watch what you eat. You have to get some exercise in. And I know knee arthritis might be stopping people from doing exercise, but then you got to go focus on the nutrition side. And it's a lot easier to, let me say that differently. The calories you put in, you can control. It's not always easy to control, but the calories you consume are very controllable, and it's a lot easier to consume calories than it is to burn them and bring burn more calories than what you eat, to put yourself in a caloric deficit to lose weight. So you need to look at your habits and all that stuff. I'm not saying for you, Cindy, necessarily. I mean, it's for everybody, it's for myself included. I've been calorie counting lately and trying to bring the weight down myself. So thank you guys. Thank you for commenting on all that. All right, we got one last comment here. Cindy says, all this information is so helpful. I so appreciate you and your team. Thank you, Cindy. I appreciate it. We all know the people that come here every week. We've been a family and like to help each other. Thank you, Kimberly. You guys are great. I appreciate you guys. Mike Music, thank you for my certificate. I just received it yesterday. Congratulations, Mike. We send everybody who completes our tests in our program a certificate in the mail. So hopefully we will see that on our weekly group coaching call, Mike. I'm looking forward to it. LaJuan Lewis says, thanks, Doc. I just had my knee replaced 3 weeks ago. Doing good. How to do it, but your exercises and helped my transition. Working hard on balance not to have the second knee replacement. Yeah, some of you guys need to have a good job, LaJuan, but at least you can avoid the next replacement. And doing this stuff is also going to help you to keep your knee replacement healthy, so you can hopefully not have another knee replacement on the same knee, but definitely not have the other knee replaced if you can avoid it. So excellent. Cool Peeps says, I currently have gel injections in my knees. It lasts 6 months to a year. Can I just inject my knees forever and ward off surgery? Thanks. No. It's not fixing your muscle imbalance. It's just temporary. The gel shot is like a hyaluronic acid injection, which is similar to what's already in your knee, what you naturally have, but it doesn't fix the problem. It's just a temporary solution. The doctors are going to tell you to go back every 6 to 12 months indefinitely. It doesn't solve it. You need to go get better glutes, offload possibly, and avoid strengthening your quads. Guys, thank you so much for your time. I appreciate you watching. Hopefully you got something out of this. Let's go avoid a knee replacement surgery. See y'all next week.